At the end of that process, considering all the data, did you arrive at any expert opinions?
Yes, I did.
All right, I'd like to start with your main expert opinions and then go through those. Can you please tell the jury what your main opinions were?
So like I said, there are opinions embedded within them, but the main opinion is that Ms. Heard's report of intimate partner violence and the records that I reviewed is consistent with what we know in the field about intimate partner violence, characterized by physical violence, psychological aggression, sexual violence, coercive control, and surveillance behaviors.
And what was the other main opinion that you had?
The second main opinion was that that Ms. Heard demonstrated very clear psychological and traumatic effects or the exacerbation of trauma from those statements that Mr. Depp made through his attorney. There were 3 statements that we evaluated to see how they affected her emotionally and psychologically, and it was my determination that they did.
And did you arrive at any diagnostic conclusions?
Yes, I did.
And what were those?
I diagnosed Ms. Heard with post-traumatic stress disorder.
And what, if any, etiology was associated with the post-traumatic stress disorder?
So the etiology is the cause. In order to meet criteria for post-traumatic stress disorder, you have to have an actual cause. It's one of the few diagnostic entities that we have to have a cause for, and the cause was the intimate partner violence by Mr. Depp. That was what was pushing the symptoms. That was what was related to the intrusive phenomena. That was related to her avoidance. That was related to her differences in her mood. That was related to her avoidance efforts. So it was the cause was the intimate partner violence by Mr. Depp.
Okay. Now, let's first go back to the forensic evaluation. You mentioned you reviewed documents. What documents did you review?
So I'm going to refer to my list of documents so that I can be clear for you all. It is a 4-page.
All right, if you want to approach.
Dr. Curry testified that one test showed, quote, intentional exaggeration in the 98th percentile, meaning that she engaged in extreme levels of exaggeration, end of quote. Do you agree with that?
I do not.
Why?
Because that test, the scale that she is referring to it's called ATR. It's the atypical response scale. As I said, that combines rare symptoms and over-endorsed symptoms. It's very frequently elevated in people who have high levels of distress. And then importantly, on this test specifically, it says, do not use the percentile rank. It is in the manual, it is in italices, because the way that this test was normed, it was normed on people who have trauma. So it's what we call negatively skewed. That means it falls on the tail end of the continuum. It is not a normal curve where we would normally think of how a percentile would work. So you would not use the percentile rank on this test.
Did you administer any tests that are specific to domestic violence?
Yes, I did.
Which ones?
So that was the conflict tactics scale, the abusive behavior observation checklist, and the danger assessment scale.
And what did they show?
I would like to refer to the testing.
To refresh
To
your
refresh
recollection?
my recollection, just a glance so
Yes,
I
you
can
may
be
do that.
clear with the jury. So what the overall gist of the testing was that, and the benefit of these tests is that they allow me to ask for what Mr. Depp did to Ms. Heard and then also what Ms. Heard did to Mr. Depp. So it was asking about both sets of behavior. And
Objection, Your Honor. We're back to reading.
She wasn't even looking down. She was looking at the jury.
I don't. Go ahead.
Please continue.
So what these tests show was that there was a high degree of serious violence perpetrated by Mr. Depp toward Ms. Heard. There was violence more on the mild level perpetrated by Ms. Heard toward Mr. Depp with one severe indicator, which was the punching that she indicated to me. There were scales about negotiation, about how much this couple tries to figure out their problems. They both scored, again, this is Ms. Heard reporting that, but they both scored in the high range where they're both saying that, yes, we're trying to figure this out, we're trying to work out this relationship. There were scores on the psychological aggression scale where Mr. Depp engaged in more severe acts of psychological aggression, whereas Ms. Heard did engage in also some mild and severe acts of psychological aggression. The amount of injury that was reported was significantly higher and more severe by Ms. Heard, what she was subjected to, and then she was subjected to sexual violence where Mr. Depp, based on her report, was subjected to none. And then on the danger assessment scale, that there were a number of factors that were related to severity in violent relationships and a risk factor. When we look, as I said earlier, when behaviors come up on this scale, they're very worrisome, very scary, and we have to take them seriously. So there were a number of behaviors that came up on this scale, such as Mr. Depp threatens to kill her, the increase in severity of the abuse, the forced sexual activity, the choking behavior, his obsessive jealousy.
Objection, foundation.
She's talking about the test results.
Overruled, go ahead.
Please continue.
The obsessive jealousy, the control aspect, and his threatening of suicide to kill himself. So those were risk factors that placed her in the increased danger range. And this is a range that, says that we certainly have to advise women of their risk and consult with law enforcement if they're involved, or judges if they're involved, because this means that a woman is at risk for more serious or lethal domestic violence.
So did the results of the psychological tests you administered to Amber Heard support a diagnosis of PTSD?
Objection, leading.
What, if any, psychological tests did you administer that supported a diagnosis of PTSD for Amber Heard? Sure.
So there were 4 tests that supported that diagnosis. One was the PAI, which was that 344 question large scale personality inventory. On that test, her largest subscale, her highest subscale, was the one that measures traumatic stress. So that was clinically significant. On the TSI, 2 of her scales were the intrusive experiences dimension and the defensive avoidance dimension, 2 of the classic scales of trauma and PTSD. On the PCL, which is the post-traumatic stress disorder checklist 5, that she scored in all 4 domains of PTSD, and that's an instrument that says how much are you bothered by these symptoms, and in all 4 clusters, which would be the intrusive experiencing, when things about the abuse or the trauma enter your mind when you did not want them to. Sometimes they're cued, sometimes they're uncued. She answered in the avoidance category, which is a second category of PTSD, that I do things to try not to think about this, to try not to feel this, to try not to get upset. Sometimes I avoid certain people because they become a trigger for me. She scored in what we call the negative alterations in cognition and mood, changes in her thoughts and feelings as a result of the abuse and trauma, and also in the physiological hyperactivity, the hyperarousal, the hypervigilance, the startle response. So on the PCL, she endorsed symptoms in all 4 of those categories, saying, some of these symptoms are bothering me a lot. And then finally, the clinician-administered PTSD scale for the DSM-5. And what that allows me to do, unlike the PCL, is really look at symptom severity and symptom frequency. How is this really playing out for this individual? And similarly, she scored in all 4 categories of trauma and of having intrusive experiences and nightmares and avoidance efforts and physiological hyperactivity and changes in her mood and her thoughts. And her total score was a 28, which falls in the moderate range. So that means that she has experiencing a moderate degree of post-traumatic stress disorder symptomatology. And those tests allow me to make that definitive diagnosis that she suffers from PTSD.
Thank you. What, if any, consideration did you give to Amber Heard's history of childhood abuse in making your diagnosis?
I mean, that was a significant consideration, given that we know that childhood, well, first of all, we know that people can experience multiple traumas across the lifespan. And we wanted to make sure that the symptoms that she was experiencing were related to what she experienced with Mr. Depp and not her childhood. And certainly, you know, earlier on in the evaluation and when I evaluated and spoke with her, that was true. And that was also true on the latest measure, the clinician-administered PTSD scale for DSM-5, the CAPS-5. And that's because the content, you have to look at what is the content of the symptom. So it's not that someone says, oh yeah, something traumatic comes into my mind. No, what is it? What comes into your mind? What bothers you? What are the triggers? And those were all specific to Ms. Heard's relationship with Mr. Depp. The reason the childhood is also significant is that we know that if somebody suffers childhood abuse as a child, they are much more likely to have an adult re-victimization. And they're much more likely then to be more vulnerable to obtaining a PTSD, to getting PTSD, if they've had that prior vulnerability. So it's a very strong vulnerability characteristic to obtaining PTSD when you have a subsequent trauma. The other aspect about her childhood abuse is that she was raised in a family of violence. She was physically abused by her father. She saw her father abuse her mother. Her father was very explosive and had violent outbursts. And both her parents also struggled with substance abuse very significantly. So she had learned from a very early age how to caretake, how to live in a situation that is mired in chaos. How do I take care of a parent who's passed out, knotted out from heroin? And how do I get up and get my sister to school? She learned at a very early age that she had to figure out how to do this in this scenario. And I would say lastly, what that environment taught her was that she learned that she could love someone who hurts her. She knew that people who hurt her also can love her. And she learned how to have this tolerance for cognitive inconsistency, this tolerance for two should be diametrically opposed emotions. But she grew up knowing or believing perhaps that this could happen. And she also believed that she could fix him, just like she tried to fix her father and just like she tried to fix her mother. She truly, truly believed that she could fix Mr. Depp and rid him of his substance abuse problems. But that did not work.
Please like, subscribe and share your thoughts.